It's a type of medical care that's gaining momentum across the country. All your health care for a flat rate monthly fee and more time spent with your provider. Good Morning Indiana's Elena Martella shows us the details on direct primary care.
It's on the rise on a national scope.
It's not simply that it's a more affordable type of care, but it is really a concierge level private physician that is very different from the local clinic you might be used to.
And gaining popularity right here in the Circle City.
I saw that there was a lot of shortcomings and just kind of some inefficiencies in how we delivered care. So I was always looking for a way to provide care in a more meaningful and more efficient environment.
Dr. Rashid Patel says he spent 9 years in a traditional family practice, then made the switch.
I had seen a lot of colleagues across the country doing this direct primary care model, and so I started looking more into it and seeing what it would entail to bring that to the Indianapolis area.
Having practiced under the model for a year, he says costs are saved in the long run and patients don't receive surprise bills.
We typically do everything by a monthly membership fee, so that includes all of the office visits, the in-office testing, and we do a lot of e-visits and telehealth in our office.
Dr. Ashley Ope says she decided to practice under the model following her own experience of gaining access to care.
I found it nearly impossible to get access to a doctor without, begging, and then when you finally did, you only had a few minutes in front of that person. Some tests were ordered. If they didn't tell them what they needed to know, they just sent you on.
She says the transparency in billing also plays a major role in her move.
When you've had several surgeries in the hospital and you see the bill, it's shocking.
Less billing code headaches and more one-on-one time.
The most important thing to me really is the relationship with patients. That's what's really rewarding to me about medicine, is the relationship I have with my patients.
You know, Lauren, doctors Patel and Ope tell me that the typical clinic visit gets 12 minutes, but with this type of care, they can take 30 minutes to 60 minutes depending upon the need with their patients, so they really can develop those relationships.
And that's really interesting. A lot of people are wondering, how they're going to pay for their health care. It's really unsure about the cost with the Affordable Care Act and different things going through, so this is another option.
Exactly, and if you want to learn more about this option, just visit our website, theindychannel.com. I'll set up a web story, more information about this option.
All right.